The other spot that I think the pig really differs from the human. The large intestine is this ball of intestines. Okay, I actually heard a student yesterday ask whether this was the brain. It's not. The brain would be in the head, like ours. The large intestine is a solid bunch of attached, looks like intestine, looks like it says a ball. Our intestine actually goes up, over, and then back down. All right, theirs is all grouped up like this. The small intestine is the stuff that's loose. Now you can see where they have latex in here that has ruptured from the blood thing. If you guys want to pull this out, you can. But the small intestine, we got the large intestine, it doesn't come apart. Where the small intestine, you can pull all the individual. Oh, nice. You can pull all the individual intestines apart. That's the small intestine. The rectum. If we pull aside the small intestine, and we get down to the bottom down here and pull out some more of the latex. Okay, and you can see this tube that goes from basically up here down towards the anus. That's the rectum. It stores the fecal material. It's the where the poop is stored. Okay, the large intestine, going back, the large intestine, the purpose of that is to remove water. All right, that's where your water absorption takes place. The small intestine is for digestion and the breakdown and absorption of nutrients. So you have the stomach, the duodenum, which is the first part of the small intestine right here, the small intestine, which is all this stuff here, and then you have the large intestine, which is the brain-looking part. I have no idea what that is, and this is the rectum. Okay? All right? The mesentery. Mesentery is kind of an important thing here. It's between the small intestine. So you pull the small intestine apart, and you'll see like a fan-like substance. Can you guys see that right there? All right? You pull it, and there's a fan-like substance. That's the mesentery. It's the blood supply for the small intestine. And it actually is where, once the the nutrients are absorbed in the small intestine, that's how it gets in the circulatory system. And it's the vein-looking stuff between the small intestine and the diagram. All right? Going down, we're not going to cover the ovary yet. Just going down. Let's see if we're missing anything. The heart. Let's go down to the heart just now up here. Up at the top here, you have the heart. All right? It's the big thing in the center. Around the heart is the pericardial sac. It's actually in you've cut the pigs. To get to the heart, you had to cut it. It's a clear sac. But basically there's a little bit of fluid in it. And it adds it's like a shock absorber for your heart. So you can jump up and down and do everything, your heart doesn't take a beating. Now that sac can fill up too much and put pressure on your heart, and that causes problems. A lot of medical shows will talk about that. But it's just a little sac. It's the clear tissue that you can pull off of the heart. Okay, this is clear tissue right here. All right? Now the thing is, what we want to do is remove the heart. So what we want to do is pull that pericardial sac back so we can really get to the heart. And then this is the kind of, it's not a skilled thing, but you have to kind of have a little bit of intelligence. I'm going to take the scissors and just cut underneath. I really want to lift the heart up and just kind of snip anything that's holding it in without cutting the heart or tearing it like I just kind of did. Okay, so I kind of lift it up and pulling it up, and I want to try to cut down, but I don't want to cut the lungs, and it's just kind of get underneath there. And now I have the heart. And I try to do that so that I can lay it back into the pig if I want to. All right, so I have the heart. Going down here, continuing the pericardial sac. The lungs are the side. They have never been full of air. They're actually full of fluid right now. But those are the lungs. And then, like I said, the heart, and I can lay this heart back into the pig the way it's supposed to be. All right? And then we get down to the aorta. The aorta, how am I doing that? Not great. A little disappointed. All right. The aorta is the large white vein right here. All right? And I'll get let's get to the diagram so we can see this. Here is the diagram we're looking at. There's the diaphragm we talked about. The lungs are on the side. the heart, and the aorta is this little tube right up here. It's the main artery to the rest of the body. All of the blood that flows from the heart goes to the aorta. Then I want to take the heart. Now, I have it in here, and that's the way it was. Everybody understand that? Yes? I want to lift it up, and I want to cut it parallel to the table, but not all the way through. So I'm going to take it. That's the way it sits. I'm going to take it and cut it about halfway through so that I can open it up and I can look inside. But I still, and I can tear it at this point, and I still have it in one piece. I can still fold that back over and put it back in, and it's still a heart. Does everybody understand what we're trying to do? Okay. And I'm going to go over the parts, and I'm going to show you later on the board exactly what we're talking about. But remember, it's from the pig's point of view. So when I say we're going to talk about the right atrium, it's on our left. It's the pig's right, but our left. So the right atrium, if we open it up, is up here. The right ventricle is down here. And think of it alphabetically. Atrium at the top, ventricle on the bottom. AV. Right atrium, right ventricle. Left atrium, left ventricle. All right? And I will show you how the blood flows because you need to know that. Or I'll show you that up on the board. The vena cava is the blood vessel, the vein that goes back into the heart. And honestly, I probably destroyed it, and I usually don't ask that question, so don't sweat it too much. And then, of course, hair of the chinny chin chin. Does that make sense, everybody? So far? Hit the pause button.
There's a pause
Okay.
button. Where's the pause button?
You're killing me.
Oh my gosh, my arms.